I'm Dr. Fiona Tuhebwe, and welcome to the WHO Africa Media Briefing, which is taking place in collaboration with the APO Group. And first, we'll have some housekeeping. You can choose the language you'd like to hear for the press conference by turning to the globe at the bottom right and selecting your language. And also to ask questions, please use the question and answer function on the Zoom application. Please also remember that you'll need to provide us with the name of the news organization you represent to have your question answered.
Oui, bonjour à tous et merci de vous être rejoints à nous. Si vous souhaitez écouter la conférence en français, merci de cliquer sur le globe qui est situé tout en bas de l'écran à droite. Et si vous souhaitez poser une question, merci d'utiliser notre feature Q&A. Et si vous avez ces mêmes questions, merci d'utiliser votre nom et le nom de votre publication. Merci.
And joining us from Brazzaville, the Republic of Congo, is Dr. Richard Mihigo, the Vaccine Preventable Disease Program Coordinator for the WHO Region Office for Africa. And now I will hand over to Dr. Mihigo to introduce our other panelists.
Thank you very much, Dr. Fiona Tuhebwe. And good morning, good afternoon, and welcome to this press conference. Today, we will look at the critical issue of vaccine safety and Africa's capacity to regulate high-quality vaccines and other medical products. So I'm very pleased that we are being joined by Dr. Boitumelo Semete, the Chief Executive Officer of the South Africa Health Products Regulatory Authority, and by Professor Oyewale Tomori, who is the Emeritus President and Professor of Virology at the Redeemers University in Nigeria. So thank you very much for joining us today. There have now been over 4,355,000 confirmed cases of COVID-19 in Africa, and over 115,000 people who have sadly died. Case numbers have fallen over the last month, and in the last 7 days, they fell by around 7% week on week, down from nearly 79,000 to just under 73,300. Yet cases are still rising in 15 African countries, including countries like Kenya, Ethiopia, Libya, and Tunisia. So Africa is not out of the woods yet, and complacency is not an option at this time. Turning now to COVID-19 vaccine, over 45 countries in the African continent are now vaccinating, including 36 through the COVAX facility, with over 13,800,000 doses administered so far. Safety remains our top priority, and there are encouraging signs that Africa's monitoring and reporting systems are working well. All African countries have baseline safety surveillance system in place and are reporting on any side effects and severe adverse events that occur following vaccination. So to date, the vast majority of reports involved either mild to moderate side effects with headache, fever, nausea, pain, and numbness at the site of injection being the top reported side effects. There have been no case of blood coagulation disorders reported following vaccination in Africa. In recent days, we have seen the United States take the precautionary measure of suspending rollout of the Johnson & Johnson vaccine in the United States following reports of blood clots and low platelets following vaccination. With, as you have also followed, South Africa also announcing that it will temporarily halt the vaccine rollout. The WHO Global Advisory Committee on Vaccine Safety is closely following developments and will share any findings as soon as possible. However, it's very important to note that nearly 3 million lives lost to COVID-19 across the globe, and WHO considers that the benefit of vaccine far outweighs the risk. COVID-19 vaccines authorized for emergency use listing by WHO are safe and can significantly reduce the risk of severe illness and death, which is our primary concern for the moment. So vaccine safety starts with good regulation. From research and clinical trials to manufacturing and monitoring the rollout of vaccine, strong regulatory systems are crucial. Africa has a solid base to build on. Yet, investing in manufacturing capacity and national regulatory authorities is critical to provide essential immunization program and to build strong, resilient health system to tackle future health emergency. To achieve this, we also need to build capacity and boost the regulatory harmonization in Africa. We therefore call on all member states to urgently ratify the treaty set up by the African Medicine Agency as soon as possible. To end, I must come back to the vaccine equity. While on average 1 in 4 people has received the COVID-19 vaccine in high-income countries, it's just sad to say that just 1 in 500 of all doses given globally have been administered in low-income countries, including Africa. Some African countries have already used all their doses, more or less falling far short of reaching health workers and high-risk population, let alone everyone else. So finally, it cannot be said enough that no country is safe until all countries are safe. Thank you very much, Dr. Atuebu.
Thank you very much, Dr. Mihigo. And now talking of regulatory harmonization in the region, Dr. Semete, could you please tell us the stringent regulatory measures that South Africa has put in place for the COVID vaccines?
No, thank you very much. And thank you for inviting us at SAPRA to this very important conversation. And thank you to the media houses that are represented here. So as the South African Health Products Regulator, we've been involved in regulation of these vaccines right from when the clinical trials were being conducted. As many of you are aware, there are a number of clinical trials that are taking place in South Africa. And some of these included clinical trials for the Pfizer vaccine and even for the AstraZeneca as well as the J&J, and there's a few others that are ongoing. So from a safety perspective, as we oversee these clinical trials, we then have been getting data on the implementation of these clinical trials. That obviously gives us data on the safety of these products, but also provides us with data on the efficacy of these. So during the development of these vaccines, we have then been kept up to date regarding these areas. The other important aspect that we continue to oversee is around quality, as our mandate speaks to safety, quality, and efficacy. So when it comes to quality, inspection of the sites where these vaccines are conducted is critical. We've now put in place also virtual inspection mechanisms, and we also apply reliance on the reports that are coming from those regulatory authorities that are PICS compliant, because we can't always travel. And now with the restrictions, we've not been able to travel to the sites. The last part in terms of our regulatory oversight when it comes to vaccines is that once these are authorized, and I'll talk to what we look at when we authorize in a few minutes, once these are authorized, our work doesn't stop there. We have mechanisms in place for what we call post-market surveillance. So this is where we monitor the rollout of these vaccines, we monitor the safety as these vaccines are being rolled out, and we also get reports on the efficacy as they're being rolled out. For all the vaccines that have been authorized in South Africa, there is a requirement for this post-market surveillance reporting. So for us as a country and for us as a regulator, we've been overseeing the clinical trials, and also a key requirement in terms of the monitoring of these vaccines is what we would call a risk management plan that the manufacturers would submit to us as part of their dossier, wherein we review that in detail and we look at what are the elements that they would be monitoring as these vaccines are being rolled out. So very much aligned to the post-market surveillance. When we review these data, we look very much at the safety elements of it. With the context of the 501YV2 variant, we've also had to look at the data that is available for these vaccines against this variant. This is a variant that we know is the predominant variant in South Africa. We're starting also to see it in other neighboring countries of South Africa. So it is important that whatever authorization we provide, we do reflect and we do have data on these. We also are cognizant that we may not have all the clinical data, and that's why the post-market surveillance becomes important to ensure that we continue to monitor the efficacy of these vaccines against this variant that is dominant in South Africa. I just want to reflect on the J&J vaccine, which in South Africa has currently been made available through a phase 3B clinical trial to our healthcare workers. And so again, this remains to be a study, and we've been getting reports from the study principal investigators on the safety as well as the efficacy of this vaccine. This has been quite important to us in that we're able to generate local data on the performance of this vaccine, and also the data we gather from the Sisonke trial will enable us to even better inform our rollout strategy. So if I could also just reflect on the recent developments where the FDA and the CDC has put a pause on the rollout of the J&J vaccine in the US. It was actually at the time that we had just received the data from the second set of data from the Sisonke study on the safety of this vaccine. We've reviewed that data in detail as SAPRAM. The ethics committees also wherein this study is being rolled out have looked at that, and we have not noted any serious side effects. The reports that we get on this vaccine, they cover any adverse effects following immunization, and they also cover any adverse effects of special interest. So the category is quite wide. We also have reports, to some of the more minor side effects, such as a slight headache, tiredness, fever, anaphylaxis, etc. So we've been getting detailed reports, but we can say, as at the 12th of the data from the 12th of until the 12th of April, we have not seen any serious side effects related to this thrombosis effect that has been reported. For the rollout, we will also be implementing what we call the Mat Safety app that will be utilized to actively collect data on the safety of this vaccine. And this app also has been used by Ghana, by Nigeria, and Ethiopia is also utilizing it together with the MHRH and the FDA. And we will be sharing this data. We've formed a collaboration under the AU NAPID, AU3S program, so that as different countries, we can then also share on this data. So it also speaks to the importance of us collaborating as African countries so that we can share the data that we are receiving, data that is very specific to our country. So I guess the question would be, why then did South Africa and why then did SAPRA pause the study if we didn't pick up any serious side effects? And the reason is that we need to, particularly since this is a phase 3B study, the safety of the participants is quite critical, but also we need to look at the totality of evidence. It would be prudent for us as a regulator to reflect on data from the US, particularly since they've vaccinated much larger numbers than we have. In this current Sisonke study, we've only vaccinated just around 290,000 or so healthcare workers. So it's important that we reflect on the totality of the data. And so we will continue to monitor this. We've indicated that this pause is a temporary pause. We understand the importance of vaccinations. We know that all the countries, we have to roll out these vaccines for the safety of our populations, but also it's important that where we do pick up any side effects, we reflect on that. I will pause here, thank you.
Thank you very much, Dr. Semete, for those enlightening information and really the reassurance that the South African government has put in place. So now over to you, Professor Tomori. Do you think that more clinical research on vaccines need to take place in Africa?
Thank you very much. Can you hear me now?
Yes, loud and clear.
Yeah,
Professor.
thank you. I think South Africa has shown us what it is to have more countries in Africa getting involved in clinical trials. Unfortunately, right now, we only have 3 African countries that are involved in clinical trials: Egypt, Tunisia, and South Africa. And from what Boitumelo told us, it's obvious that we need local data because of geographical differences, demographic differences, to be able to walk over these things. Because of these differences, each country, at its own reason, needs to have these clinical trials in their place. But more importantly, there are certain viruses, for example, for a virus like COVID that has different kind of mutants that are occurring and variants occurring in different parts of the world. It is important for each country to be able to do a clinical trial to see how well its own variant reacts against the vaccine that is produced. But on even a larger scale, there are certain diseases in Africa which are only limited to Africa. Take Lassa, for example. Take monkeypox, for example. These are diseases which are actually based in Africa. You don't have them in other parts of the world. And therefore, you don't expect us to be carrying out clinical trials for Lassa fever in the streets of New York when there's no case there. So African countries must invest in clinical trials, specifically to have local data, as Boitumelo said, but also as we look forward to other diseases which are peculiar to Africa and which we need those clinical trials for. Over.
Thank you very much, Professor Tomori. Indeed, African solutions to African problems. Now, on a slightly different topic, we have Dr. Keita, the WHO Incident Manager for the Ebola response in Guinea, who can tell us about the latest development in Guinea. Over to you, Dr. Keita.
Can you hear me?
Yes, we can hear you, Dr. Keita. Go ahead.
Okay, thank you so much. So regarding the ongoing EBD outbreak in Guinea, it should be mentioned that yesterday we reached 12 consecutive days without new Ebola confirmed cases. We have already vaccinated 95% of the contact being followed up by a surveillance team on the ground, which is also a good performance. However, one of our confirmed cases and some suspected cases are still in the community, and we are trying to find them and to isolate them. Yes, we have also some challenges in terms of contact tracing because 25 contacts are still lost to follow-up. During the last week, we faced some community reluctance which delayed our intervention and the implementation of public health action around confirmed cases. Alert remain suboptimal in Zerekore, the epicenter, and very few alerts are reported in the neighboring districts, which is not a good performance in terms of surveillance, but actions are ongoing to improve these indicators. Globally, the situation, yes, we have already 12 consecutive days, but we are not confident because we are facing some challenges in terms of surveillance, and we have coordinating effort are ongoing to find this confirmed case in the community and all the suspected cases on the ground. Over to you.
Thank you very much, Dr. Keita. Now that we've heard from all our panelists, it's your turn to ask questions. And on hand, we also have Dr. Tieno Balde, the WHO Team Lead Operational Partnerships, who can also answer questions on emergencies in the African region. Remember that to ask your questions, please use the question and answer function on the Zoom application, But also remember that you'll need to provide us with a name and the news organization you represent and to have your question answered. And also, we can also answer your questions live. And for now, I'll give the first chance to Paul Adepoju from the BMJ to answer your question. Please go live.
Thank you very much. Thank you for the update regarding the Ebola outbreak. And my first question is around these issues. So because recent findings show that the new outbreak originated from someone infected back in 2014 and 2016, showing the extent to which the virus can linger, what are the implications for stigmatization and people coming forward, and also medical workers? So how are these concerns being addressed? Then with several African countries running out of doses of AstraZeneca vaccines, what is being done to ensure that those that have received the first doses can still get their second doses? Thank you very much.
Thank you very much, Paul. So the first question will go to you, Dr. Keita, and the second question will go to Dr. Mihigo.
Okay, thank you so much. For we are now implementing a new program for Ebola survival in Guinea, taking into account all the intervention to reduce this stigmatization in the community. So after the 2014 AVD outbreak, we implemented a kind of program. So we are going to do the same, but all these concerns are taken into account to minimize stigmatization in the community.
Thank you, Dr. Keita. Now to you, Dr. Mihigo, on the question regarding with the several doses of AstraZeneca, what is being done to ensure that those who have received their first doses can get their second dose?
Yeah, no, thank you, Fiona, and thanks to the journalists. So I think we have reported in the past some delays that a few countries witnessed in the provision of the second delivery of vaccines, particularly those who are supplied through COVAX by the Serum Institute of India, and all the advocacy efforts that were done to make sure that we will not have some disruption. I'm really glad to announce that the delivery of the vaccine have restarted. Since the beginning of the week, we have several countries that have received their consignment. Last night, Niger received the vaccine, Guinea, Guinea-Bissau, Comoros, and we are working hard with all the partners within the COVAX facility to make sure that those countries that have received the first installment beginning of March will soon also receive their second installment. So it's a global supply issue. But things probably are going to get better in the next coming weeks. And we are not expecting any issue with regards to the second doses that are going to be provided in many countries after 12 weeks.
Thank you very much, Dr. Mihigo, for that reassurance. And we see quite a number of hands from the journalists. Please indicate if you want to go live with your question. Otherwise, please go ahead and type it in the question and answer function. The next question is from Virginia Pietromarchi from Al Jazeera, and the question is, the US has suspended the use of the J&J vaccine while EU countries have restricted and even ended the use of the AstraZeneca one. What will the impact of such moves on vaccine trust among people living in Africa? And how is this going to affect national rollouts across the continent? I'll give this to you, Dr. Mihigo, and then we'll ask Professor Tomori to also weigh in.
Okay, no, thank you. This is a really interesting question. Clearly, we are following very closely these issues, but I want to say that the AstraZeneca vaccine so far has been the vaccine that has been used by the majority of the countries. It's a vaccine that is still being used in many parts of the world, not only in Africa, in Asia, in Latin America, even in Europe. So the suspension of let's say the pause that has been put in the United States and in South Africa, we have heard about the J&J vaccine. I think it's just normal things. I think we have gone through this situation with the AstraZeneca vaccine when the first cases of the thrombotic events were reported. This is what we are going through in terms of the J&J vaccine. And I think there have been a reassurance that were provided both by the European Medicine Agency, but also by the WHO after consultation with the Global Advisory Committee for Vaccine Safety on the benefit of these vaccines versus the risk that it entails. Now, in terms of affecting the confidence in the African region on the continent, I think it's this is not a situation that we're going to be peculiar to our region. I think it's a global situation. We need all to continue to monitor closely this situation, strengthen our system in terms of pharmacovigilance. We've heard a very, very good plans on risk management that is being implemented in South Africa. But I'm also, in my preliminary introductory remarks, show that most of our country are strengthening their surveillance for AFI. So all of these are signs that should and will definitely reassure the opinion to continue to receive those vaccines.
Thank you, Dr. Mihigo. Over to you, Professor Tomori, to weigh in on this.
Okay, sorry. Thank you very much. I was just excited to I hope you can hear me now. Thank you very much, Richard, for what you have said. I think we need to continue to bolster up the confidence of our people. And I think we need to go back to even the older, reliable vaccines like yellow fever vaccine, which has been in existence since 1930s. Today, people are still finding side effects with it. The more you use it, the more you find side effects. And so, but the balance is always the benefit versus the risk. With millions of people that die from yellow fever, for example, will you compare that to the side effect that maybe 10, 20 people get? So that's the most important. Even the polio that we talked about, there's still side effects that are coming up on it. And yet we have used that polio vaccine to eradicate polio in Africa. I mean, that to me is the message we should be pushing to our people. There will always be side effects. There will always be issues to look at. But as Richard said, we need to continue to monitor it and take appropriate action against it. We are unfortunate in Africa a little bit to say that Europe and America can't afford to suspend what they have because they have alternatives. We don't have. But then the alternative we have is still very useful. So I think we should bolster our people's confidence to say that no matter what, the evidence is there that we have greater benefits with this than the risk we are getting out of it. Over.
Madam Chair, if I can just also add, if you don't mind.
Yes, go ahead, Dr. Semete,
Thank
please.
you. I have to agree with Prof. Tomori, and also to just add and say the public must have confidence in the regulators, in that our regulators are really working hard to identify these. We've all put in place mechanisms to monitor these vaccines. And the fact that we are able to then say, let's pause, let's review the data, and we come back, that should give the public confidence that we're looking at these matters in a lot of detail. Thank you.
Excellent. Thank you very much. Now, next we go to our question, which is to you, Dr. Mihigo, from Baije, from China Central Television. And they say less than 2% of the global COVID-19 vaccine doses have been administered in Africa, where most countries received vaccines only a few weeks ago and in small quantities. China has started since February to provide the COVID-19 vaccines to 35 African countries and the African Union Commission, while wealthy countries are stockpiling more vaccines than they need. What is your opinion on this phenomenon?
Well, to respond to this question, I will first start by saying that since the beginning of the pandemic and the launch of the Access to COVID-19 Tools Accelerator, for which COVAX is the arm from vaccine delivery, I think WHO, but also other partners like Gavi, CEPI, have tried really to work hard to make sure that the issue of global solidarity is at the core of the COVAX facility. And we have seen a tremendous response in terms of global solidarity, country putting money, resources to enable the COVAX facility to buy and then to roll out the vaccine. As I've said in my introductory remark, we have almost 45 countries, including 36 that have received already vaccine through the COVAX facility. So it's really a big achievement. However, as you have said, these vaccines that are coming are in small quantity. And we have called at several opportunities for those countries that are holding the vaccine, that have excess dose, to donate those vaccines to low-income countries so that we can as well protect the people who are most at risk, as well as those who are on the forefront of responding to COVID pandemic. So this is even more the opportunity today to reiterate that call. We do appreciate the efforts that China has done to provide some doses. We will even call more for more doses to the countries that are needed. So, and in conclusion, I will say that the overarching approach that we would like the international community to take, it's really the solidarity. It's really to equitably distribute these vaccines so that those who are most at need, wherever they are located, can be immunized at the same time in every place in all continents.
Thank you very much, Dr. Mihigo, again. Yes, for that passionate call. To you, Professor Tomori.
Yeah, I just wanted to also add that Africa should take this as an opportunity to prepare for the future. We've been at this receiving end of global donation for too long. Now is the time for us to plan for the future. We shouldn't be in this same position again. And so we're appealing to our leaders also to be proactive and move us forward and stop us from being this childly dependence on the world. Africa must rise up and our leaders must be proactive in getting this. We shouldn't repeat this situation where we are at the donation, at the mercy of everybody. Over.
Thank you, Professor. And they say one word from the wise is enough. And I think we've had. So the next question goes to you, Dr. Semete, and it's from Malibongwe Daimani from News 24 in South Africa. What are the South Africa clinical trials showing us about the Johnson & Johnson regarding its safety? And are you surprised by the results coming from the US about the serious side effects on the 6 women?
Thank you. I'll start with the second part of this question, in that these thrombotic effects that we're seeing, if you remember, these were noted with the AstraZeneca vaccine, and we're now seeing them with this J&J vaccine. And, you know, there's causality studies that are currently being done, but, you know, from some initial indications, it seems that it could be related to the vector. But again, this will be said with certainty once these studies are concluded. So when we're looking at the J&J, we're also not only looking at the data around the J&J, we're looking at the AstraZeneca because they're using the same types of platforms. So that's an important consideration. In terms of the clinical studies that were done in both, with both these vaccines in South Africa, as I've said earlier, we didn't see, you know, some of these effects. But I guess that's what clinical trials are for. But also, as you start to roll out, there are some effects that you would see that you never saw in a clinical trial, because with the rollout, you now are availing it to a much larger population group than you would have in a clinical trial. So, you know, as we've indicated, we will continue to monitor these as they come through. But at this point, we haven't seen this effect to the same extent, if any, in the South African context. Thank you.
Quite reassuring. And again, thank you for letting us know that the higher the numbers that are receiving the vaccine, the higher the chances that we shall see these side effects. And now over to you, Sarah Jerving from Devets. Kindly go live with your question.
Thank you so much. Dr. Mexico, I believe you said that COVAX deliveries have started again. Could you clarify what the source of the manufacturers is for those doses and what the quantities are? And then Dr. Keita, can you please explain in more detail why you've not been able to contact trace those 25 individuals? What are the specific challenges around that? Thank you.
Thank you,
Okay.
Sarah.
I'm not sure if I got the question very well. I think what I said, we have started to see the resumption of the delivery in few countries. We have 6 countries that were targeted for delivery this week: Mauritania, Guinea, Guinea-Bissau, Niger, Comoros, can't remember the last one, which was a very good sign of the resumption of the delivery, at least for vaccine that are coming from Serum Institute of India. And we are getting some reassurance that the second delivery that was planned end of March, beginning of April, that were delayed due to the, as we all know, the heightened situation in India, may as well resume quite very soon. So I think this is rather very good news, but as we know, this information change almost on a daily basis. It's a dynamic situation. So we are closely monitoring the supply situation across the countries, but also with the manufacturer. So during our weekly calls, we will definitely be providing updates, and we are working hand in hand with the COVAX Secretariat, our colleague at UNICEF, to make sure that this information is transparently communicated to the countries so that we can have some plans in place at the ground level to manage these issues.
Thank you, Dr. Keita, on what's the issue? How come you've failed to do the contact tracing for these Ebola contacts?
Thank you so much. I just want to mention before that we made a very good progress over the past days, because a few days ago we were reporting 100 or more than 100 contact lost to follow-up because of community reluctance in the epicenter Suluta village. But thanks to coordinate effort from all the stakeholders, we were able to access to this community. Now we have only 25 contact lost to follow-up. So team are on the ground, and we are continuing, working on that and involving community to find this contact lost to follow. But just to mention that we made a very good progress, because from more than 100 to 25, it's very good. We are ongoing to improve and to access to all these contact lost to follow. Over to you.
Excellent strides there, and we wish you all the best. Now we go to Linton Gule from Eswatini. Please go live with your question.
Thank you very much. South Africa is regarded as a bigger brother in the SADC region. Does it mean then that when South Africa holds the use of the Johnson & Johnson vaccine, countries like Eswatini should also do the same? Thank you.
Thank you very much. I hope we all had this. South Africa now that South Africa has halted the use of the Johnson & Johnson, should all these other surrounding countries hold? I'll ask Dr. Semete to answer this question, then Dr. Mihigo, you can also come in.
No, thank you. Just to also clarify, I mean, this is a temporary pause to enable us to, thoroughly interrogate the data from the Sisonke study, but also to reflect on the data from the US. So we are anticipating that this pause will be lifted in a couple of days to come. This vaccine, and I think, the timing of these effects, finds us when not many countries have started with the rollout of this vaccine. And so it does give us an opportunity to thoroughly review this and then share this with our SADC communities. As regulators, we meet every 2 weeks And Swaziland is also part of these SADC regulators meetings that we have, and we'll be sharing this with them. So again, it's a precautionary suspension, and we'll be sharing the data. Thank you.
Yeah, maybe if I can just add a small thing on that. I think Dr. Semete made a very, very great point in terms of exchange of information among regulators. I think that's something very critical that we would like really to encourage. And I'm really want to congratulate South Africa. It's a very strong regulatory authority. And I think the more we collaborate with other countries, the better. Just to add that, as Dr. Semete said, this is a vaccine that has been rolled out in a very limited number of countries, contrary to other vaccines where we have had, and we have heard this since this morning, a more bigger base where people have been immunized and where we can reflect a bit on the safety data. So I believe that the decision that South Africa has taken through their regulatory authorities, I think we should absolutely respect that decision. I think they are all driven by the science. They are making sure that things are being checked out. And as I announced before, there will be also a discussion at the global level through the WHO Global Advisory Committee on Vaccine Safety. And we do most of the time also work with the National Regulatory Authority to come to a conclusion. So I think we should reassure the public here. And I think to have regulators taking really the lead in this and trying to make sure that they are driven by data and science, I think it's a positive development for our continent.
Okay, thank you, Dr. Mihigo and Dr. Semete. Now we go to a question from Claire with the RFI Africa Service, and I'll give this to you, Dr. Tierno. Does WHO worry about the spread of COVID-19 during the month of Ramadan in Sub-Saharan and North Africa?
Thank you, Fiona. Thanks for this question. Yes, indeed. I think we know that this is a quite punctual event which happens somehow every month, or every month. I mean, during 1 month, during every year. And I think it's really the opportunity to just continue engaging different communities, you know, for really adhering to all of these barriers, to all of the measures that has been, I mean, promoted over the past few months, you know, for really reducing the transmission of the COVID, you know, amongst the communities. So I think the flexibility that we have put in place, I mean, also all of the innovative measures, you know, for engaging communities on a daily basis in a very regular manner, in a very adaptive manner, will really help us to address these issues around the transmission during the holy month of Ramadan. So thank you so much. Hope that was clear. Over.
Thank you, Balde. And now we have Janice. Janice, from RFI, would you want to go live with your question?
Hi, I'm Janice from Bloomberg.
Yes, Janice from Bloomberg. Sorry about that.
No worries, thanks. South Africa's health minister yesterday said the country is facing delays to coronavirus vaccine supplies because of unreasonable terms being demanded by the main pharmaceutical companies supplying these. South Africa, along with India, are driving the TRIPS waiver efforts. And I was wondering if the WHO is concerned that there's a link between these very demands from the large pharmaceutical companies and South Africa's TRIPS efforts.
Thank you, Janice. Dr. Mihigo?
Yeah, no, I think this is a very important question. We have been in a unique situation during this pandemic where the vaccine have been rolled out almost at the same time that the clinical trial results are being out there, and that's to a larger number of people at the same time. So we've seen some reluctance from some vaccine manufacturing really to enter into this liability and indemnification agreement with countries to make sure that some of the events that were not necessarily seen in clinical trial, and if they are picked during the rollout of the vaccine, could not necessarily be an issue with them. So I think that those negotiations have been quite tricky with some company versus others. And Indeed, and you are right, they've delayed the rollout of the vaccine. And we've seen that particularly with those countries who were expecting the Pfizer vaccine. Now, is this also impacting the TRIPS negotiation? I think yesterday there was a very good discussion by the newly elected Director General of World Trade Organization, Dr. Ngozi, and the WHO Director General to discuss on how WHO can also work with the World Trade Organization and support countries in the issue of IP properties, intellectual property agreement. So we know very well that India and South Africa were championing the suspension of some of these IPs to fast track the deployment of or manufacturing of vaccine and to remove some of these barriers. So this is kind of a broader discussion going on currently. And we hope that what we are going through during this pandemic will definitely change the dynamic at globally during this negotiation. So it is a complex issue. It is a complex situation, and we hope that we are going to see some changes in the TRIPS agreement moving forward.
Okay, quite some good optimism right there. And now we have the next question to Professor Tomori, and it's from Razmata Diallo from the World Food Service. And the question is, could the kind of mobilization at the global level and in Africa that we have seen in the fight against COVID-19 be repeated in the face of other diseases which claim more victims in Africa, such as malaria?
Thank you very much. I mean, that's a very lovely question. I think during this COVID time, to be fair, Africa has done quite well. The African Center for Disease Control, the WHO itself have set up great institutions. I mean, like the Network for Genomic Sequencing, of which South Africa is doing a great job, Nigeria and a few other countries. So for me, the problem is not the talent in Africa. I think Africa has more than enough talents, and we're even donating some of those talents to the diaspora. The problem is the capability at home, the environment for the talents to function. The people that are going outside of Africa to go out there, you know, are doing great things because they have the environment to do great things. So my appeal would be that if Africa is going to move forward in this direction, is to change this current toxic environment for functioning to one that is conducive and enabling. Then you will see the talented African people doing the same thing. And then we can focus on our own problems. I mean, there's absolutely no reason why, you know, we shouldn't by now be dealing with issues like Lassa fever, yellow fever, which at least tend to be more of Africa's problem. And if we concentrate on that, then we're solving our own particular problem. So I believe very strongly that if Africa orients itself in the right direction, if our leaders take the right steps and the right activities, it is not attending meetings and signing documentation or something. We've seen so many of those things which have been launched, which never flew off. Time for us now to put our money where our mouth, or money where our mouth is. Go after our own disease for issues that are there, and then we'll use the talents that we have in the African region for the sake of Africa. I believe we can. I know we've done it before, just like I mentioned. It was the same African CDC, the same WHO, that has done all the great things. You remember the prediction about Ebola in Africa. There was supposed to be millions of us dying and all that. It didn't happen because, you know, the underrated, I mean, they assumed that Africa was still Africa of the past, of the Ebola past, but we've moved beyond that one. People have learned lessons from that, and we're pushing that. It is now for us to put a little more orientation of our funding in the right direction, and we'll do much better than what we are doing now. I have confidence that Africa will do it, and this is why I say this is a turning opportunity for us to move forward and focus on our own problems. We have the talent. It's now left for our leaders to bring out the enabling environment to get that done. Over.
Thank you very much. More talk to more action. Less talk and more action. This to you, Dr. Richard Mihigo from Omar Mohammed from Reuters. Can you please clarify how confident you are that African countries will be able to inject the second dose of the vaccines on the schedule? And then I'll also request Dr. Semete to come in here after Dr. Richard.
Well, I think it's difficult to say how confident we are, but I think we have very clear indication. First of all, for those countries that have received the Pfizer vaccine, for instance, where we have the shorter interval between the two doses, we have seen that the administration of the second dose is going on quite very well. And even those countries that have received the vaccine that are not necessarily WHO EULed, meaning having received authorization for emergency use, and where interval between the two doses is shorter, I think we have seen quite the second dose is going on quite well. Of course, the issue came with the AstraZeneca and where the country, I must say, took the right decision with the limited supply to use most of their doses as a first dose, with the, of course, the expectation that this delivery will come quite soon. So there have been some challenges in terms of arrival of the second dose. But I think from all the indication we have from the COVAX Secretariat and the ongoing discussion, because this is mainly pertaining to the AstraZeneca vaccine, where most of the country have applied a 12 weeks interval between dose 1 and dose 2. I think everything is being put in place to make sure that the country will receive their second shipment on time to deliver the second dose of AstraZeneca vaccine. So let's we are continuing to work in that direction, and we are expecting that these 12 weeks will be put at good use to make sure that people and country remain on track.
Thank you. Dr. Semete?
Not much to add. I think this was covered quite well. Just to say, I think also the challenges around receiving second doses also speak to the need for us for the development of single dose vaccines. And yeah, so, but not much more to add. Thank you.
Thank you very much. Back to you now again, Dr. Mihigo. We do have a number of questions for you. So this is from Syriacus Buguzi, has two questions. What is the most important thing you would advise Tanzania on how to approach its COVID-19 vaccination? And the second one is, in Tanzania, state officials and scientists have been on record doubting COVID-19 vaccines, such that a high level of public hesitancy is palpable. How can the country get out of such a situation?
Well, let me start by the first question. First of all, we have really appreciate the new development that we've seen in Tanzania with the establishment of a presidential task force to look at the issue of COVID-19 disease and vaccination in Tanzania. I think and WHO has offered the support to do that. So in terms of action that should be taken, I think we know very well that there have been a lot of tools that have been used so far, and that has been proven quite effective. The implementation of non-pharmaceutical intervention, such as social distancing, wearing masks, and other measures that really have been proven. And we do encourage definitely the country to go into that direction. Secondly, vaccination. I think we have talked about vaccination, and COVAX facility is ready to support the country to make sure that if the country decide to go that route, and we hope that will be the case, I think they can get access to the vaccines. We know very well that vaccines are not bullet magic. I think they are a very important tool that will contribute to the reduction of cases, severe cases and death. But we also need to call upon the government to make sure that, and we have seen that recently, large gathering of population without wearing face mask, for instance. preaching by example, having officials wearing the mask in public gathering, I think could send a strong signal in terms of preventive measure that needs to be taken. Now, with regards to the issue of some of skepticism around and the rumor around the vaccine, I think we know very well that this is not proper to Tanzania or Africa. I think the issue of misinformation, it's a global issue. We are definitely, of course, calling upon and strengthening the awareness of the population around this disease. And it will be interesting to see some of the officials, political leaders, religious leaders, or people who can have some influence also to speak up publicly against this disease, and then to preach some of these positive measures. I think that will help a long way to support the country in this endeavor.
Okay, so Frank Akinomo, please, from New Diplomats, go live with your question. All right, I'll go ahead and ask Frank's questions as we try to wind up. So Frank, these questions go to you, Professor Tomori. Frank is asking, in Nigeria, some people criticize compulsory vaccination for athletes participating in a national sports festival in Edo State. What individual right does such a decision affect considering health ethics? And the second question is, what stage of viral replication or disease manifestation does the vaccine assist the human immune system, especially in Africa?
Thank you very much. I think the issue of the sports and compulsory whatever, let me put it this way. If you want to travel out to another country and the country has regulations, you have to abide by it. It doesn't make it compulsory. It's your choice. And when, for the sake of the entire community, the sports commission decided that everyone should be tested and get the proper protection against it, that's the right thing to do if you're going to be a participant. There are rules and regulations and which we all have to abide. It's not a matter of compulsion or anything. It is that if I have to go to this, there are qualifications required, and then you abide by it and you participate in it. And that's the message that I think we need to take into. Again, we're talking about risk and benefit. The risk of your getting the disease spread into all over parts of the world is something that we need to address and be sure that other people are not put at risk because of what you call your freedom. While you have your freedom, other people also have their freedom. And I think I have the freedom not to get sick because of what you are doing. So you may have the freedom to say what you want to do, but also consider my freedom. So we have to balance all that one. Secondly, I think there's a very important issue about vaccines. A lot of people attribute to vaccines what is not meant to do. The vaccine is not meant to prevent your exposure. The vaccine, I mean, who you meet, to prevent your exposure, you wear your mask. That's not the business of the vaccine. The vaccine is not even there to prevent your infection, because if you get exposed, you can be infected. But the vaccine is there to ensure that that infection does not end up in your disease, does not end up in your hospitalization, does not end up in your death. So if we understand the role of vaccine, just like Richard said, vaccines are just a contribution, a part of the totality of what we're doing. You have to maintain your distance, you have to stop the spread of the disease. Vaccine has its role. It is to make sure that if we ever get infected, you don't develop the disease, and then you don't end up with death. So I think if we realize that, we will not be ascribing to vaccines what is not supposed to do. I mean, people ask, if I've gotten vaccinated, why should I still be wearing a mask? Because vaccine is not to stop your exposure. Where you go, what you do is not a matter of whether you are vaccinated or not. And who you get exposed to, who is infected, is not a matter of your vaccination or not. It is a matter of your mask. So I think it is important for people to realize that there's only so much that the vaccine can do. And don't ascribe to the vaccine what is not meant to do. And only that's the reason why we're having a lot of problems and people coming up with issues about vaccines, which should not belong to vaccines. Over.
Okay, thank you very much. And now we have the last question going to Gabrielle. Gabrielle, please go live with your question.
Hi, thank you so much. Gabrielle Steinhauser from the Wall Street Journal. There's a few African countries that have struggled to actually get the vaccines that they have received into the arms of their citizens. Do you think that governments are maybe not putting enough resources into public education and making the rollout accessible to people? And should the international community be doing more to help governments actually get the vaccine into people's arms?
Thank you, Gabrielle. Dr. Mihigo, I'll ask you to say something about that.
Yeah, I think, Gabrielle, you are right. I think we have seen in some countries, the rollout of the vaccine has not progressed at the pace that we were all expecting. But on the other, let me start maybe on the positive side. I think, as I said in my introductory remarks, I think we have seen few countries that have already exhausted their doses. People are coming to look for vaccine and they can't even find vaccines. I think we have a situation like that in Ghana. We have a situation like that in Rwanda, where people are looking for vaccine and they can't necessarily find vaccine. Hence, my first appeal on increasing the capacity and delivery to the country. Unfortunately, we have as well a country where the rollout has been a bit slower for many reasons. We mentioned the issues of misinformation, all the rumors around vaccination that are playing quite an important role in preventing some people to get vaccinated. But also there are some issues of lack of operational resources to get maybe to the remote areas and etc. And we are working with countries, mobilizing different other partners like the World Bank, other development bank institutions like the African Development Bank, to support countries to the rollout of the vaccine to the most peripheral level. But I might say that we are seeing positive signs coming to the country, putting their own money. Is not probably enough yet, but this is really a real issue that we are picking up in a few countries.
All right, we are coming to an end of this virtual press conference, and let's turn to our three panelists and hear their final messages. And I'll start with the lady, Dr. Semete.
No, thank you. I think my parting shots would be that, I think there is an acceptance that for us to manage this disease, we will need vaccines as one of the strategies, as indicated, as one of the strategies. And from a regulator's view, I just want to give comfort to the public that, regulators are looking at all the aspects that pertain to safety, quality, and efficacy of these vaccines. I think the matter of public education is quite critical. Educate the public on these various side effects, explain what this means in terms of the full rollout, but it's important that we do address the issues of vaccine hesitancy, because this intervention would be important for us to curb the disease and open up the economies. Thank you.
Thank you very much. And now over to you, Professor Tomori.
Thank you very much. For me, talking from the side of a scientist, I think Africa has done a bit well over this current situation. As I mentioned earlier on with WHO, with African CDC, the way they've approached the issue of testing and sequencing is something that is commendable. But we can do more, and we can really do so much more if our leaders join us in making sure that the talents that we have in Africa are made full use of. It requires for our leaders to get that environment, that which I call toxic environment, make it more enabling, make it more conducive for the talented Africans to do for Africa what Africa should be doing for itself. And I think we should take advantage of this COVID thing. We've been repeating the same story, starting from Ebola, starting from yellow fever, starting from whatever disease. It's always Africa whining and complaining that we're being cheated, we're being that. Nobody's cheating us. We are the ones cheating ourselves. It is for us to make all the little resources we have, put it to full use, better use, more focused use, and then we can be at par with everybody. When we talk about the vaccine diplomacy, you cannot get anything out of diplomacy if you don't have anything, bring anything to the table. You bring your raw materials to the diplomatic table, you get a raw deal. You bring nothing to the table, you get nothing. And that's what is happening. Africa must change. We must make use of what we have, and then see what South Africa is doing. They're not depending on anybody. Other countries can do the same thing because of good leadership. That's my message.
Thank you very much. And I'm sure journalists have heard this outcry for the leadership to come out. And finally, now to you, Dr. Mihigo.
Well, thank you, Dr. Twebe, for facilitating this very interesting session. Let me first thank really our two panelists. I would like really to thank you very much for your candid comments and really very thoughtful input that we've provided. And I'm sure this has increased a lot the awareness in the community on the work that we are doing on the ground. So really, thank you very much. We wanted this week to focus more on the regulation and vaccine safety because of not only what is going on, but also to shed some light on what some of the African institutions with the support of WHO are doing in regulating these medical products and particularly vaccines through the African Vaccine Regulatory Network, known as AVAREF. I think an amazing job has been done in supporting vaccine regulators in the region. A strong network of pharmacovigilance system have been established, building on what was there for the routine immunization program in different countries. And we are still seeing indeed some issues in the rollout of vaccines, as I've said before. But we, again, here take the opportunity in this conversation with the media really to continue to advocate for a more positive messaging around vaccination because vaccines do save lives. We are still in the middle of this pandemic. More than 115,000 lives have been lost to this pandemic. We can save most of these lives if we use most of the tools that we have today and the non-pharmaceutical intervention that have really been effective. Now we have a very powerful tool as vaccines. So if we combine the two, all of these tools, I think we can really keep our people and the population safe and maybe accelerate the reopening of the economies in our region. So I'd like really to thank everybody and hope to see you next week with the presence of the regional director this time. Thank you very much.
Thank you, Dr. Mihigo, and thanks again to all our panelists and to the journalists. We don't take it for granted that you keep coming to get this information. And we look forward to seeing you indeed next week. And for the Francophone reporters, we have our experts, Dr. Richard Mihigo, Dr. Mori Keita, and Dr. Tieno Balde that will remain with you online for a few minutes to answer your questions in French. Thank you very much and a good day to you all.
Thank you very much, Ophélie, for the opportunity.
Bonjour à tous. Bonjour, Dr. Mihigo. Bonjour, Dr. Keita. Vincent Defay, ici du bureau régional de l'OMS pour l'Afrique. J'ai plusieurs questions qui concernent la COVID-19 et une question qui concerne l'Ebola. Je vais commencer avec la question sur la COVID-19, qui est une question maintenant qui est récurrente concernant la sécurité des vaccins. On a vu donc plusieurs pays suspendre leur vaccination avec les vaccins AstraZeneca ou Johnson & Johnson. Pourquoi donc continuer à recommander l'utilisation de ces vaccins en Afrique? Monsieur Mihigo, peut-être.
OK, vous avez raison, c'est une question récurrente sur la sécurité. Je pense que c'est important quand même de revenir à chaque fois sur cette problématique. La sécurité des vaccins est quelque chose qui nous est très cher à l'Organisation mondiale de la santé et sur laquelle je pense que personne ne veut tergiverser. Il faut cependant dire que tel que nous l'avons annoncé, les données que nous avons aujourd'hui en fonction réellement des bénéfices de la vaccination vont réellement au-delà de risques qui peuvent être encourus. Et je voudrais préciser ici que les vaccins, mais comme tout autre produit médicale. On ne peut pas aller dans une pharmacie, par exemple, et demander un médicament comme ça sans ordonnance. Parce que nous savons que tous les médicaments ont un certain minimum de risque que nous manageons. Et on demande aux gens de ne pas prendre l'aspirine à jeun parce qu'on peut avoir mal à l'estomac, mais ça va traiter quand même les maux de tête. On demande aux gens de ne pas prendre tel médicament en telle circonstance parce qu'il y a un risque minime par rapport à ça. Pour les vaccins, c'est exactement la même chose. Ça fait des décennies que les vaccins sont utilisés. Leur sécurité est pratiquement assurée lorsqu'on compare aux faibles risques qu'elles peuvent encourir. Les vaccins continuent à sauver des vies à travers le monde. Et je pense que la décision ou les recommandations prises par non seulement l'Organisation mondiale de la santé, l'Agence européenne des médicaments et même l'Agence américaine des médicaments vont tous dans le sens pour dire que les vaccins ont un bénéfice largement supérieur à quelques rares risques qui existent aujourd'hui. Et il est important de continuer à utiliser ces vaccins. Ce n'est pas uniquement en Afrique, partout dans le monde, en Europe, aux États-Unis, et en Europe, en Asie, en Amérique latine, les vaccins AstraZeneca continuent à être utilisés et continuent à sauver des vies.
Merci beaucoup, Dr Migo, pour ces clarifications qui sont, comme vous le dites, toujours très utiles. La prochaine question concerne le COVAX. Certains pays en Afrique n'ont pas encore reçu de vaccin via le mécanisme COVAX. Que prévoit l'OMS et donc plus largement le COVAX pour s'assurer que ces pays-là reçoivent enfin leur vaccin?
Non, les choses ont beaucoup évolué avec ces pays qui restaient, effectivement, je l'ai dit au début, les rares pays qui restaient pour recevoir les vaccins COVAX sont en train d'être livrés cette semaine. Hier, nous avons le Niger qui a reçu ses doses, la Guinée-Bissau, la Mauritanie, les Comores. C'est vrai que nous avons encore quelques pays, je crois 3 ou 4, qui n'ont pas encore reçu leur vaccin, mais cela est dans le pipeline. Donc, nous travaillons énormément à travers le secrétariat de COVAX à faire en sorte à ce que les pays qui restent puissent recevoir leur vaccin dans les meilleurs délais. Cela a été dû, bien entendu, comme on l'a tous suivi, à la situation de la demande qui était extrêmement élevée en Inde et qui a mis un coup de frein sur la livraison de COVAX, mais nous espérons que la situation va se normaliser dans les jours et les semaines à venir.
Merci beaucoup, Dr Migo. La prochaine question est adressée au Dr Keita, puisque ça concerne Ebola en Guinée. C'est une question de Guinea News qui nous demande quand prévoit-on la fin de l'épidémie et surtout peut-on estimer le nombre de malades dans le pays actuellement? Dr Keita.
Merci beaucoup. C'est une question qui est difficile à répondre parce que c'est vrai qu'on a fait des progrès, comme je le disais, mais c'est des progrès un peu apparents. On a fait déjà 12 jours sans cas. Mais sauf que si nous prenons d'autres éléments comme le cas confirmé qui est encore dans la communauté, on ne sait pas jusque-là son statut final, on ne sait pas où est-ce qu'il est déjà mort, mais s'il est mort, comment son corps a été géré, quelles sont les personnes qui ont été exposées, s'il n'est pas mort, quelles sont les personnes qui sont autour de lui, est-ce qu'ils prennent des mesures, est-ce qu'ils ne se sont pas fait contaminer. Mais comme nous n'avons pas d'informations sur ce cas, donc ça reste déjà un grand défi. Alors, nous avons aussi, vous avez entendu parler la semaine dernière où on avait une grande réticence dans le village de Pagalaï, où on n'avait pas accès. D'ailleurs, c'est ce qui a fait qu'on avait beaucoup de contacts jamais vus et non vus, mais aujourd'hui, on a quand même réduit ce nombre de contacts qui étaient perdus de vue. Certes, il y a des progrès, mais aujourd'hui, c'est vraiment très difficile de vous dire avec confiance quand est-ce qu'on va pouvoir finir l'épidémie. On va pouvoir le dire avec un peu de confiance quand on aura un nombre d'alertes très élevé. Par exemple, aujourd'hui, on a très peu d'alertes qui sont rapportées à Zéro-Corée et dans les autres préfectures avoisinantes. Donc, si ces indicateurs de surveillance ne sont pas très réconfortants, c'est difficile pour nous de parler avec confiance parce que Et c'est la même chose qui s'était passé, comme vous le voyez, on avait fait 27 jours sans cas avant qu'on ait ce nouveau cluster. Mais je n'étais pas très confiant parce qu'il y a eu les mêmes questions, même avant qu'on ait le dernier cluster, j'ai dit la même chose. Tant que les indicateurs de surveillance ne sont pas très performants, on ne peut pas parler avec confiance. Donc, c'est cela la question. On est en train de travailler là-dessus pour retrouver, et toutes les ressources sont mobilisées pour retrouver ce cas confirmé qui est toujours caché dans la communauté, mais aussi d'autres cas suspects. Une fois qu'on aura une meilleure visibilité, c'est comme en fait les nuages. Quand tu es en train de conduire, tu n'as pas une meilleure visibilité sur... Donc, c'est très difficile de parler avec confiance pour dire que oui, je pense que je vais y arriver. Nous sommes un peu dans la même situation, mais tous les partenaires en appui au gouvernement, nous sommes en train de coordonner les efforts pour améliorer ces indicateurs et peut-être dans quelques semaines parler avec plus de certitude. À vous.
Merci énormément, Dr Keita, pour ces clarifications sur la situation en Guinée. Je vais me tourner de nouveau vers le Dr Mihigo. Nous avons une dernière question qui concerne cette fois-ci la Tanzanie. Avez-vous reçu des informations de la part du gouvernement? Est-ce que l'OMS a commencé à soutenir le pays dans la lutte contre la Covid-19?
Merci pour la question. Non, nous n'avons pas reçu de requêtes spécifiques de la Tanzanie après l'annonce récemment des autorités. Mais il faudra quand même souligner que nous n'avons jamais cessé de continuer à travailler avec les autorités nationales. On a continué à appuyer le pays depuis les débuts de cette pandémie dans les différentes formations en ce qui concerne le renforcement, par exemple, des laboratoires, la provision des équipements de laboratoire, des tests de dépistage. Nous travaillons énormément avec le pays dans les aspects liés à la communication pour sensibiliser la communauté autour de la maladie. Et cette collaboration continue jusqu'à la date d'aujourd'hui. Mais de manière spécifique par rapport à cette task force qui a été mise en place par les nouvelles autorités, nous n'avons pas encore reçu de requête officielle de collaboration sur ce sujet-là.
Merci énormément. Je voudrais donner une chance au Dr Baldé de s'exprimer sur la situation concernant Ebola aussi, mais en RDC. Est-ce que vous voulez ajouter quelque chose peut-être, Dr Baldé?
Peut-être juste mentionner un peu les difficultés qui sont mentionnées un peu au niveau de la Guinée. Je ne dirais pas qu'elles sont similaires du côté de la RDC, mais c'est des enjeux qui sont importants. Ça revient à mon point antérieur aussi sur l'importance un peu de l'engagement communauté et aussi donc leur adhésion donc par rapport à toutes ces différentes actions de santé publique que nous sommes en train de mener. Les enjeux que nous rencontrons en Guinée, c'est des enjeux aussi que nous rencontrons aussi en RDC à différents niveaux. Mais en RDC, ce qui est particulier aussi, c'est un peu la composante sécuritaire. On a une situation qui est relativement stable. On est à 42 jours aujourd'hui sans nouveaux cas, mais la situation sécuritaire qui est au niveau de Guinée et de Boitumelo quand même nous amène à parler avec beaucoup plus de précautions. Donc, parce qu'une fois de plus, on n'a pas énormément de visibilité sur ce qui s'y passe. Et donc, pour conclure, je pense la nécessité d'avoir un peu vraiment une réponse concertée, multisectorielle, pas juste du côté de la santé, mais que chacun y joue son rôle. Je pense que c'est quelque chose vraiment de très, très important, que ce soit les instances techniques, les organisations techniques, mais aussi les communautés, mais également aussi toutes les personnes, toutes les autorités qui sont impliquées dans ces ripostes-là. Cette synergie-là, c'est celle-là qui nous permettra, je pense, vraiment de pouvoir résoudre toutes ces problématiques de santé publique. Donc, merci beaucoup de l'opportunité. À vous.
Merci énormément, docteur. Nous avons fait le tour de nos questions. Docteur Mihigo, peut-être que vous souhaitez dire un mot final?
Non. Merci beaucoup. Je pense que nos collègues francophones, nous sommes toujours disponibles à la fin de ces interviews d'apporter un peu plus de clarification. Mais sinon, je voudrais remercier encore une fois tout le monde pour le temps que vous consacrez à ces briefs, à ces briefings de la presse sur la situation actuelle. Et nous espérons vous retrouver la semaine prochaine à la même heure.
Merci beaucoup, Dr Mihigo. Merci, Dr Baldé. Merci, Dr Keita. Merci aux journalistes d'être restés un petit peu plus longtemps. Et comme il vient d'être dit, à la semaine prochaine.